lot of research that says this. You have to say to those people, you want your kids in with those kids? And they all understand it that way. And then you have to say, look, we've got some stuff we're going to do with them. They're going to do some community service. They're going to do some, some mediation or whatever, right? And so you're showing, and then you quickly change the subject, say, this is what we're doing with the high-risk kids, right? Because who are you worried about? Right? You're worried about the high-risk kids. And here's the good thing about juveniles, much more so than adults, there is still a lot of public support for helping these kids. I mean, they want them held accountable, but they want to help them. Most folks, public opinion polls consistently show that. They want these kids taught a lesson or whatever, but they don't want them executed. They don't want them, locked up for years. They want somebody to say, I'm sorry I did it, and somebody to say, look, we're going to work with these kids to help see they don't do it again. So I don't think it's that hard. I do this all the time, and I've spoken to Kiwanis clubs and Rotary clubs and all kinds of groups. And when you get up and start talking about kids and how you do things, you'd be surprised how much interest there is in that. And so you can't let the loud voices, in the communities that want to scream for, locking everybody up to win the day. And I always tell the story, and I always use Virginia as the example, right? So if the member of the family, they're driving through the hills of Virginia in the fall, and they're looking at all the leaves in the trees and how they're changing, and they see this big house, and it says, Dr. Smith, veterinarian and taxidermist. And they think that's a pretty funny combination. When they get up close, it says, either way, you get your dog back. So that's what I always say to those people that, they want to lock all these kids up. That's fine, but where do you think they're coming back to? They're coming back to your community. You want them to come back better than they went in? So, and that's what you have to say to them, All right, listen, it's about, any more questions? We're going to take a break. All right, thank you, all of you.
I'm sorry. Susan Farmer just want to share with you a quick announcement as well. I'll give her the opportunity to do that. We're going to be back in this room, please, punctually at 10:59 after our break. And just wanted to also point out to you, Tracy mentioned, please do visit the exhibitors in the next room to learn about programs throughout the state. And we know after Dr. Latessa's remarks this morning, and thank you for stimulating our thought process and challenging that. In your packets are suggested questions as you visit the providers that are in the next room, and I know that hopefully you have that many more challenging questions about programs having heard this morning. So please do be back in here punctually at 10:59, and Susan did want to remind you about prizes that will be awarded throughout the day as well.
Make sure you come. We have great prizes. We have vendor prizes. We have some other things through VJJA. And want to win. You got to be here. So if you don't have someone here that's walked out already, you might want to tell them. Okay, and enjoy the rest of the day.
We're going to get started here. Right before lunch, I can get you to do most anything to eat. I decided in this second period of time to talk a little bit about the ethics model and kind of what we're doing, why we're trying to do this, and a little bit about it. Then I've got, if we've got time, I've got two sessions. One is what we call a bad session. All right, somebody not trained on ethics, And then I've got actually a video of a session. It's an older youth who came out of a facility. And so he was there for a number of years. He's come out. He's now on parole, so probation. And so it's interaction with the ethics model. So first is, of course, why ethics training? There is some evidence, some studies, a new one that's coming out, a meta-analysis that found that probation is really no more effective than other types of sanctions. That's one. Of course, some like Beer believe if we can get community supervision right, we can reduce incarceration by 50%, have less crime, and spend the same amount of money, if not less money. So there's a lot of support for trying to do things in the community. Some of the things that some of the rationale again behind it is this issue of dosage, right? How do we increase the dosage of treatment, right? We just learned about how important that seems to be. Fairly dramatic with high risk, as I said. We saw very dramatic cuts if you give them. The length of community supervision, and so especially with kids, not always a long period of time. So you've got this challenge of increasing the dosage, but we don't keep kids on probation for 5 years or 10 years like we sometimes do adults. The whole caseload size issue, right? What do we hear? I've got too many cases, I can't see them all, I can't, right? So we're trying to say, okay, low risk, you don't have to do as much with. High risk, you need to be more. Oftentimes we don't know the risk. Some folks don't assess risk, and what happens then? Some harm, and everybody gets the same thing. The availability and quality of community referrals. I first started thinking about this probably about 10 years ago. We were doing some work in Ohio with the judges, the juvenile judges, you know, and I talk about programs and effective programs like I do. And I had a couple judges raise their hand and they say, listen, we don't have all these programs. You know, I got 3 POs. That's all I got, you know. And so can you work with them and teach them how to do some things there? And so we started to design this training to teach POs kind of how to interact better with kids and how to use some of these techniques. And so that was some of the thinking as well. We've known for a long time from research that it's the content of the interaction. People ask me all the time, what should caseloads be? How big should they be? You know what, I have no answer for it. Because none of the research has shown there's any magic number. Contacts. How do you increase intensity now? You see them more. That's what you do. You have more contacts, right? We have no research that says that makes any difference. Right? We've been doing them studies since the 50s. And so it's what you do when you meet with that child, youth, not how many times you see them. Right? And think about it. How many hours are there in a day? How many days? I mean, how much time? So you go from once a week to twice a week for 10 minutes. It's like, you know, it's so small to be not going to make any difference. Most interactions with the youth focus on external control. You will do this because, right? Not internal control. And then there's lots of other policies and procedures. Right? The research is suggesting the relationship with the officer and what is discussed is most important. Okay? One of the reasons I could be effective in changing Allison's behavior was because I'm her father. We have a relationship. She doesn't want to disappoint me. She wants to do the right thing by me, right? And so think about it. If you're working with someone who you think cares about you and is going to help you, you're a lot more likely to pay attention than if you think all they're out to do is to catch me screwing up. All right? They found in one study that that the development of supervision plans was based more on what the court mandated than what on the assessment indicated. Okay? So it was all around those conditions and not around that assessment.